The pandemic had many unanticipated side effects on emissions, on work, travel and more. So what was the environmental impact of the pandemic? Our topic on this week's COVID-19 special. In Indonesia, for example, illegal deforestation increased. But first, the coronavirus and animals. Do animals and humans infect each other? And if so, what can that teach us? Scientists in the Netherlands want to find out.
The province of Flevoland in the heart of the Netherlands, dotted with fields of tulips, canals and modern architecture. But Flevoland's capital, Lelystad, isn't just home to exotic concrete structures. It's also where the possible future shape of the COVID-19 pandemic is being sketched out. Researchers at the Wageningen Bioveterinary Research Labs are looking at the way SARS-CoV-2 behaves in animal tissue now and how it might behave in the years to come.
We need to study all kinds of animal species that may be infected with SARS-CoV-2. So first look whether we see symptoms of SARS-CoV-2 in these animals, and if we see that, test these animals, whether they're infected, and also whether they can spread the virus.
Wim van der Poel has studied the disease, for example, in hamsters, which can be infected by COVID-19 and pass it on to us. Symptoms in the rodents are not that different than in humans. They include lethargy, weight loss and shortness of breath. This is what the lung tissue from a hamster infected with COVID-19 looks like. By testing how viruses behave in animals, the scientists can anticipate and estimate how great a threat they might also pose to humans. The question of whether an animal is able to spread COVID-19 is an important one. The more virus cases there are, whether in animals or in humans, the greater the chances the virus will mutate. Trying to reconstruct infection chains is very complicated. One theory some scientists in China proposed for the origins of the Omicron variant, for example, is that the variant's predecessor could have leapt from humans to mice, a process known as spillback. They think it could have mutated in the animals into Omicron's immediate ancestor, which then jumped back from mice to humans. And mice are not the only suspects.
Actually, there are quite a number of animal species that are susceptible to the virus. The question is always whether it is only an initial infection or whether the animal will also be able to transmit the virus to other species, or the same animal.
Mink do have the ability to transmit COVID. This is what the coronavirus looks like in them. After being first reported in the Netherlands in February 2020, COVID-19 ripped through mink populations in European farms. When the virus mutated and the animals began infecting staff at the farms, Denmark's government took drastic action and culled every farmed mink in the country, millions of them.
In Denmark, in the mink outbreak, we saw that the virus changed in a way that it could become more infectious to people and could also spread more rapidly in people. So these animal transmissions can be very important and can be very risky for public health reasons.
In the US, researchers are now looking at the potential threat posed by white-tailed deer, which may yet prove problematic for the course of the pandemic. The World Health Organization currently estimates that 1 in 3 of the animals across the whole of the US have been infected with COVID-19. That's in the wake of an outbreak that started mid-2021. One paper, not yet peer-reviewed, reports a case where the virus is thought to have jumped back from deer into humans. Another danger is that deer could also potentially spread the infection to domesticated livestock, which would further increase the risk of exposure and spread in humans. The Wageningen researchers are trying to predict and possibly prevent events like that before they can occur. It's a difficult task.
Well, I hope that our modeling can help us to bring us a step ahead of the virus in the future, because at the moment we wait until a new variant arises and then we respond to that.
Getting one step ahead would allow vaccine developers time to test and tweak vaccine alternatives. It could also provide early warnings to public health officials to prepare infrastructure, a central aspect of managing any pandemic. That the virus will change is a given, But being able to anticipate those changes and prepare for them could help save lives.
Illegal logging has long been a problem in Indonesia. But under the pandemic, it's grown worse. In part because many communities turn to logging to survive.
When COVID-19 hit Indonesia, the country faced another outbreak, deforestation. A report shows 50% more forests were cleared in the first 20 weeks of 2020 than in the same period a year earlier. Indonesian environmentalists like Uli Arte Siagion say this spike in deforestation was no coincidence.
When we talked with the authorities in several regions, they said that when they were in lockdown during the pandemic, they weren't able to do their jobs as usual. Most of them were working at home. So the authorities said it was difficult for them to monitor the forest.
Uli Arte Siagion says that forest patrols also fell victim to budget cuts during the pandemic. And the economic downturn had another effect, one that originated in the cities. As unemployment grew in urban areas during lockdown, many migrant workers returned to their villages, putting further pressure on forests.
The data showed that the migration of people from cities to rural areas increased significantly. From 36.7 million in 2019, it increased to 40 million people early in the pandemic. These 40 million people are more than a quarter of the total workers in Indonesia.
People from the cities looked for work in their villages, where agriculture is the dominant industry. But more people in the village means less land to cultivate legally.
The amount of land that can be legally used has dropped. When more people move from cities to rural areas, they try to find new land.
While much of the legal land in the villages has been sold to large companies for mining or large-scale agriculture, the villagers try to make a living by illegally farming in the forest.
In many cases, they believed they had no choice but to turn to illegal land in the forest. Many people were forced to find new land in the forest to survive. But they can't be fully blamed. The problem is caused by agrarian inequality, which is the main cause of increased deforestation in this country.
In March 2020, Indonesia lost more than 1,200 square kilometres of forest, far more than in previous years. Environmentalists are warning of a looming catastrophe if deforestation continues.
During the pandemic, coronavirus restrictions kept many people at home. Factory production was ramped down and people commuted and travelled less. What impact did that have on greenhouse gas emissions worldwide? Our reporter spoke to Miriam Wolfram of CDP Europe, an NGO that advises companies, cities and governments on how to build a sustainable economy.
Hello, Mrs. Miriam Wolfram. Very nice to meet you. We heard that the emissions decreased during the height of the pandemic and the lockdowns. Can you tell us why?
Well, first, yes, the emissions dropped significantly during the pandemic, around 8%, according to the International Energy Agency. And actually, this is really the emissions, about the percentage of the emissions needed every year in emissions cuts for the next decade, so until 2030, says the United Nations, to meet our 1.5 Paris target. And the reasons for these drops in emissions, Julia, is because many parts of the world came to a forced stillstand in order to curb the spread of the COVID virus, bringing much of the global economic activity to a halt. The inactivity affected mostly ground transportation and aviation, but also, of course, industry and related power generation, causing carbon emissions to decline.
Has this decrease had any significant effect on climate change?
No, it has not, is the unfortunate answer. Although the pandemic and resulting limitations on, economic sectors, but also travel, of course, drastically decreased air pollution and greenhouse gas emissions at large, the decrease has no long-term impact. The only thing that will have long-term impact is a systemic permanent change. So we have a momentum now, and we must ensure that we don't lose this momentum, that the pandemic might be also nearing its end. And to give you one example, CDP has reported record disclosures between 2020 and 2022, an increase from 9,600 companies to over 13,000 companies reporting their environmental data in 2022. The growth illustrates that the pandemic has not stopped companies around the globe to continue their efforts in, environmental transparency and action. And this is a good news. It is essential to maintain and strengthen businesses now, investors and governments' commitments, as well as, of course, the citizen support to really achieve and continue moving into this just and inclusive and green transition.
Are the emissions back to the same level as before the pandemic now?
Unfortunately, global emissions have rebounded to quite varying levels in 2021 to reach their highest ever annual level, with a 6% increase from 2020, according again to the International Energy Agency Global Energy Review. This rebound has reversed the pandemic-included decline in emissions, and CO2 emissions in 2021 rose above the pre-pandemic levels in 2019. Coal, for example, accounted for over 40% of the overall growth in global CO2 emissions last year. And deforestation, land use, and agricultural expansion continue to contribute to global emissions, with agriculture driving almost 90% of global deforestation, according to the UN Food and Agriculture Organization. So in short, the pandemic did not help climate action.
Thank you very much for this interview.
The coronavirus makes people sick, and so do fine particulates. Like the virus, they enter the airways and end up deep in the lungs. So is there a connection between fine particulate pollution and COVID-19? DW's Joachim Eggers spoke with an expert on fine particulates and their health impact.
I brought something along, Miss Peters. This is glitter. Let me quickly hold it up to the camera. Glitter, so it's really small. Is this the size of the particulate matter we're talking about?
The fine particulate matter we're talking about is a bit smaller, less than 2.5 micrometers. And this particulate matter is about a millimeter. If you inhaled it, most of it would get stuck in your nose, and only a few particles would end up deep in your lung.
The dangerous ones that go into your lungs, how big are they?
They're smaller than 2.5 micrometers. 1 millimeter is 1,000 micrometers.
Well, I brought this stuff along so that we can demonstrate it. So it's 100 times smaller than this here. 1,000 times smaller?
100 to 1,000 times smaller.
That's amazing. So you can't see it with the naked eye.
Exactly. You can't see it with the naked eye. Here we have up to 5,000 particles per cubic centimeter. And if you were to stand at a road with a lot more traffic, you'd get between 50,000 and 100,000 particles per cubic centimeter.
Where does it come from?
The fine particulate matter that can be dangerous to our health is the result of combustion processes. It could be cars or power plants, coal power plants or domestic heating. All of these are sources for particulate matter.
Drivers, cyclists, pedestrians, and people who live near busy streets. With every breath, they inhale millions of potentially dangerous tiny airborne particles that affect their immune systems.
Colleagues of mine at the Barcelona Institute for Global Health carried out a very good study. It showed that people who live in areas with high air pollution levels have a 30% higher risk of developing COVID-19 if they're infected with the virus.
Annette Peters and her team are also conducting a large-scale study.
We now know that fine particulate matter doesn't just affect the lungs, but basically the entire body. It can contribute to cardiovascular disease, to metabolic diseases, and we also know that fine particulate matter affects the brain. Whether that leads to higher rates of COVID-19 in a particular region is one question. The other question is, what are the long-term effects? Does fine particulate matter also contribute to long COVID, for example?
Peters and her team's study involves 1,500 subjects. Some of them have had COVID-19.
My husband and I had COVID last November. My husband was in the hospital with suspected pneumonia. I was at home, so we were both in isolation.
But you're both fine now?
Not really. We both still have trouble walking. We start to sweat when we exert ourselves. We can't handle it.
The subjects undergo various tests, including a lung function test. Many long COVID patients have trouble getting enough air, but the medical tests are only part of the study.
Und beim nächsten Mal dürfen Sie etwas tiefer ausatmen. Und und aus. Und weiter ausatmen, weiter ausatmen. Es geht noch ein bisschen, Sie machen das sehr gut.
The researchers also send out a car that's especially equipped with a kind of funnel on the roof. They're measuring the levels of fine particulate matter where the Mateos live.
We'll continue to collect data here in the city of Augsburg until the fall. Then we'll carry out a quality control process. In 1 to 2 years, we'll have initial results on fine particulate matter in COVID-19, as well as on the various infection control measures and people's health during the pandemic.
Ivermectin is often touted as a wonder drug for COVID-19. That's even though the World Health Organization has said the antiparasitic is unproven as a treatment. Officials in Mexico City have come under fire after spending millions of euros supplying ivermectin to residents with COVID-19.
For 2 years, Claudia Cerezo took ivermectin, thinking it would protect her from getting coronavirus. The 53-year-old had read about the deworming agent's supposed benefits on social media. But she knew the drug didn't work after she and her husband contracted COVID-19 earlier this year. So when a doctor at a public hospital gave them a medical kit that contained ivermectin, Claudia was skeptical. She says they weren't properly informed and feels that their health was experimented on.
There was no information from the public health authorities, neither on their homepage nor from the doctors. You feel like they're saying, take it and see what happens.
She was one of 200,000 patients to receive a medical kit distributed by Mexico City officials that contained ivermectin, even though the WHO and the federal government discouraged COVID-19 treatment with the drug. City authorities carried out a survey that looked like a clinical trial to justify its use. The document was published on the open-source platform Socarrive. But in February, the article was removed for what sociology professor Juan Pablo Pardo-Guerra calls its deliberately misleading data.
In addition to the statistical flaws, which were tremendous, the database was very poorly constructed. The analysis was biased. And the quasi-experimental methods generated positive results, but they were forcing the data.
City officials defended the distribution of ivermectin, citing its supposedly low risk and cost at an early stage of the pandemic, when there was less evidence and fewer available treatments. However, officials declined to give an interview to DW about the ethical questions of supplying an unapproved drug without providing information to patients. Yet public health analyst Javier Tello says city officials agreed to the purchase of nearly 300,000 packages of ivermectin worth an estimated $1.5 million.
They looked at the fact that large quantities of the drug were bought, especially when the news of its possible use first emerged. But that's a very bad justification from the Mexico City Secretary of Health, who said it was what they had based on available evidence. But there was no evidence.
Mexico City has stopped distributing ivermectin, but the drug is still being promoted by vaccine skeptics. Misinformation that can cost lives.
During the pandemic, many people around the world took comfort in long-standing traditions. Celebrating festivals and reviving old customs helped sustain families and communities. So too in the mainly indigenous regions of Ecuador.
Every year in June, the indigenous communities of northern Ecuador celebrate Inti Raymi, the Sun Festival, although in many parts of the country this ancient ritual didn't take place during the pandemic. Blanca Bonilla is a traditional healer. She works as a volunteer advisor to local authorities in the Cotacachi region.
When we heard there were COVID cases in the coastal area and also in other countries, we had a clear plan about what we would do once it reached our region. We made lots of positive progress with our experiments fighting the virus.
Authorities and Quechua villages work hard to maintain a relationship of trust. The indigenous community's hierarchical structures are respected and valued. And that didn't change during the pandemic.
We never thought it would hit us this hard, our country and our communities. After the government ordered a lockdown, we had to take matters into our own hands. But it wasn't all that hard. Everyone here has their own garden. Everyone stores produce.
Cotacachi Canton has a population of roughly 40,000, spread across urban and rural parishes. The main industries are tourism and agriculture. There were fewer COVID infections here than in other parts of Ecuador.
In 2020 and 2021, the health office here in Cotacachi Canton registered 1,755 cases. 30 patients died and 1,715 patients recovered.
Despite the restrictions in the last 2 years, some remote rural communities chose to celebrate the Inti Raymi Festival of the Sun as usual.
When the pandemic went global, it also had an impact here in the countryside. It didn't only affect people's health, it affected celebrations and cultural life here in the canton. Cotacachi is famous for its cultural life and music. There are many artists here. It was a blow for culture.
For some communities in the Andes and Ecuador, the last 2 years had some benefits. They revived many of the customs of their ancestors.
Many of our communities welcomed the fact that young people began using medicinal herbs again.
For people who live in the countryside, all plants have medicinal value. Our knowledge was handed down to us by our mothers and grandmothers, by our elders, by our neighbours. We're gradually acquiring more expertise and sharing it with other communities. Vervain helped save our lives. It was incredible.
On June 24th and 25th, the Quechua communities will celebrate Inti Raymi, and the village squares will be filled with life.
That's all for this edition of our COVID-19 special, with a focus on the environmental impact of the pandemic. Next week, we'll take stock of where things stand in the pandemic right now and check out some of the new research on COVID-19. For now, thanks for watching and see you soon.